All right. Well, welcome to another installment of McKinley Caregiver Resource Webinars. I am Tamiko Gates. I am the Transportation Director for McKinley Transport. I am so excited to be here today with you all and with Dr. Kep. We have a great webinar planned out for everyone. This is a conversation that we know we have to have, but sometimes we dread having it. So I felt like it would be best to enlist a professional to join me on this conversation. I would love to introduce Dr. Regina Kep. She is a board certified clinical psychologist, gerontologist, as well as former staff psychologist at Atlanta VA Healthcare System, where for 10 years she provided direct care and consultation on the geropsychiatry outpatient medical health team. After several years, Dr. Kep recently stepped down from her role as assistant professor at Emory University School of Medicine, Department of Psychiatry and Behavioral Science, to become the founder and CEO of Euro Champions. Did I say that right, Dr. Kep?
Gero
Euro
Champions.
Champions, right. It is a company that provides training and education to enhance the mental health and wellness of older adults and their families. Dr. Kep has served on several national, regional, and institutional committees aimed at enhancing care and services for older adults and their families, and is dedicated to culturally informed care when working with older adults. So Dr. Kep is also the creator and the host of Psychology of Aging podcast, where she discusses the aging process and its complexities. She has been featured in the Chicago Tribune, Insider, Fatherly, and has recently been selected as a contributing author to Psychology Today. Thank you so much, Dr. Kep, for being on this webinar with us. Again, we know that this is a difficult conversation, but a much needed one. And you are the best kept secret in my life. And I know that you will be such a treasure to others. Thank you for joining us today.
Oh, thank you so much for having me. I'm delighted to be here, and I'm delighted to be helping the families that you all serve at McKinley. It's very important. I see that I'm the host now so that I can share my slides. So I'm going to go ahead and share my slides and we can jump in.
All right.
Okay. That was just my iPhone breaking. Nobody worry.
Oh.
Okay, so let's see. I can share my screen. And let me make it big. Can you all see that?
Yes.
Yes.
Excellent. Okay, so before you take the keys, here are some expert insights for starting the conversation about stopping driving. So in today's webinar, I am going to show you how stopping driving affects older adults. I'm going to review the warning signs and share recommendations for what to do if you're concerned. So stay with me until the end, because I will have for you a warning signs checklist that you can get for free, and I'll show you how to get that. I'm going to ask you to turn off all distractions. We have about 50 minutes, 55 minutes together, and this is a tough topic, and I want you to get all the value that you can from it. So if you are here, you may be finding yourself in a situation with your older loved one when it comes to driving and uncertain about where to start. You might be worried that when you do start the conversation, your loved one is going to have a really strong reaction. Maybe you're going to push them away. Maybe they're going to blow up. Maybe they're not going to trust you with anything else in their care. That's a very common concern. Or you might be afraid of offering to help, because if you do offer to help, you might be asked to help with everything, and that will put more on your already full plate, right? Your plate runneth over. You don't need any more on it. So you're kind of cautious. So why me? So you heard a little bit. Usually I don't get an intro. So I'm a Stanford trained board certified clinical psychologist. I'm a professor of gerontology, and I've spent more than 15 years providing mental health care to older adults and their families. As Tomiko said, at the VA Medical Center here in Atlanta, sometimes I would get called from primary care doctors and say, Dr. Kep, there's an 85-year-old person in my office who I've just told can no longer drive, and he's threatening to harm himself. Can you come and talk to him? And so for years, I would work with families in this really complicated situation with stopping driving. And you can imagine these are, I was working also with veterans who really, have a sort of macho ethic, and most older veterans are men. So there would be, who are you to tell me that I can't drive? I'm old enough to be your grandfather, and all of these things. So what I'm going to talk with you about today is what I have learned from this more than 15 years of working with older adults and their families around these really complicated situations. So I'm a national leader in geriatric mental health. I've sat on national boards to create mental health programming for older adults and their families at the VA at large, and other national committees as well. And you heard about the other things. But I'm here to say that you can indeed help your loved one stop driving and remain independent without arguments and power struggles. So today we're going to talk about how driving and stopping driving affects the emotional, physical, and cognitive health of older adults. And this is really important because empathy is key when we're talking about big transitions in people's lives. I'm also going to talk with you about the warning signs that you need to be aware of, and then what to do if your loved one is no longer safe to drive, or maybe you're wondering, are they safe to drive? What do I even do? And then we'll talk about how to work with me if you're interested, and then answer questions. So the first expert insight is really to help you develop some perspective and empathy about what actually does happen when older adults stop driving. So there are major emotional, physical, and cognitive implications and consequences to stopping driving for your older loved one and for you. And so it's pretty key. And I'm guessing that most of the people here are family members. But it's key when we're talking about stopping driving. So true or false, older adults are bad drivers. Let's see if I can get in the chat here and see. Would you say true or false? Older adults are bad drivers. Oh, was somebody trying to do a poll? Some people are saying yes. Let's see if I can see in the chat. So some people say yes, but I can't see the chat. So let's see. No worries. A common thought is that older adults are bad drivers, but in fact, older adults are more likely to wear their seatbelt, less likely to drink and drive, more likely to drive the speed limit, more likely to adjust driving in response to medical problems and medication use than any other age group. And actually, they're the least likely to be the driver in a lethal accident, but they're the most likely to die from a car accident. And so if they're a passenger in a car accident, they're most likely to have, the most significant medical problems as a result. So actually, older adults are not necessarily bad drivers. The worst drivers are 16 to 24-year-olds. But Tomiko believes it. Okay, so now let's talk about how driving affects emotional, physical, and cognitive health. So driving helps older adults to remain independent. It helps to maintain the morale and sense of self-confidence, and it helps to facilitate a sense of contribution in the community. If you've spent much time with older adults, you might hear, oh, I love going to the Waffle House for my morning breakfast. It's like my crew, I go there. Or I have a men's group that I go and play cards with, or I have a women's group a book club that I spend time with, right? And before COVID, people used to go into the community and do that. Or I spend time with my church family, or it's important for me to visit my family in another city. So when older adults stop driving, the risk for depression nearly doubles. They make 15% fewer visits to their doctor, even though they might need the medical care. They make 65% fewer trips to friends, family, and church. That's a big 65% fewer trips. And they make 60% fewer shopping trips to the grocery store or other, like Walmart, for your needs. So that's a big deal. And imagine all of these changes result in a shrunk social network, right? Your risk for cognitive decline increases. You tend to stay socially isolated, and you're more likely to be admitted to long-term care. So another thing that's really important, so a lot of times stopping driving and dementia can overlap. And just because you have a diagnosis of dementia doesn't mean that you have to stop driving right away. But what we know about dementia is that most people living with dementia live with a family member in their own family home and are cared for typically by a family member. And what we also know is that people with dementia who have adequate social interaction with other people fare best even with dementia. And so if you have a dementia disorder and you stop driving, I'm not saying all people with dementia should drive forever, but imagine your social network shrinking, right? And then that affects your illness process. Isolation affects all of our illness processes as well, not just dementia. Okay, but stopping driving also affects you, the family member. So 78% of family caregivers provide transportation. It's the most requested type of assistance by older adults. 78%. That means many of you on this call today or this webinar today will be in this 78%, right? Tamiko's raising her hand. So can you relate? So you already have a lot on your to-do list. So then you're one of the 78% that are providing transportation. You're going to have more on your to-do list. And then you're more likely to be stressed out, more likely to be burned out, feeling resentment, not another doctor's appointment. No, I can't take you to the grocery store. Didn't we just go 2 days ago or over the weekend? And then when you're feeling resentment, like, oh, I don't want to answer this phone call from my parent, then you start to feel guilty. Like, I feel like I'm such a bad daughter for not wanting to answer this phone call because how much time do I have left with them? But I can't possibly put anything else on my plate and I'm tired of this position I'm in, right? And then this cycle starts all over. Then you have more on your to-do list, then you're stressed out and burned out, then you start to feel resentment, then you feel guilty, and then it's this vicious cycle. So when we talk about stopping driving, well, let me ask you first, can you relate to that? I mean, yeah, it's some tough stuff for the older adult and for you. So it's a big family dilemma. It's a family problem. Okay, let me see if I can see that. Oh, there's the chat. Yes, I can see. Okay, I see the results now. Thank you. So tell me, can you relate? Put a yes or a no in the chat box if you can relate to this cycle. Feeling stressed out, burned out, resentful, and then guilty, and then doing it, and then feeling stressed out, burned out again. Okay. So as we talk about stopping driving, like I said, starting out this section, empathy for your loved one and compassion for yourself are key to having healthy conversations about driving. Of course, older adults some of them will kick and scream because they're not just kicking and screaming about stopping driving. It's kicking and screaming about, I've seen my friends get depressed. I've seen people isolate and not go to their doctor or see their friends and family. I've seen my friends, or I don't want to have to ask for rides to make shopping trips. Of course, my social network, my lifestyle is going to change. I like going to the bank. I like talking to the tellers. Nobody goes to the bank anymore. That's not the point. The point is, this is my community. So the second expert insight is for you to know the warning signs. And so today we'll go through the warning signs. So once you have some empathy for your loved one and some compassion for yourself, this is going to be hard on you and it's going to be hard on your loved one, and you can get through it. You need to know the warning signs. So this is the warning signs checklist that I put together with information from the National Health, Highway Safety and Traffic Administration. And so I'm going to go through this checklist with you. And you don't have to memorize this or anything. I'll show you how you can get this checklist at the end, and then I'm happy to also share the slides with you. So one of the checklist items is, does your loved one get lost in familiar areas while driving? Have you noticed new dents, scratches, or other damage to your loved one's car? Has your loved one been warned or ticketed by a police officer for poor driving? Has your loved one had any close calls or car accidents lately? Has a doctor advised your loved one to limit or stop driving? Is your loved one overwhelmed by road signs or signals, markings, or other things while driving? And so you'll notice this, like sometimes when an older adult is getting closer to stopping driving, they might even stop in the middle of the road to figure out what's happening here, which is dangerous. Does your loved one take medications that might affect their ability to drive safely? So remember, older adults are more likely to adjust their driving habits when they take medications or their medical, their physical changes, they have physical changes in their body. And so this might have to do with judgment, right? So maybe your loved one is not making changes. That's atypical for older adults. Older adults are more likely to say, I just had a pain reliever, I should not be driving. I just had, I just took some muscle relaxer, I should not be driving, right? Or I don't drive at night anymore because my vision is not as good. You hear adults talk about that. Or I don't drive on the freeway if I can help it. I drive the side streets because it's slower and other people are paying more attention, right? You'll hear older adults talk like that, and that's good judgment. So if you're seeing your loved one use poor judgment when they wouldn't use poor judgment before, that's also a warning sign. So does your loved one stop inappropriately or drive too slowly? Does your loved one have a medical condition that might affect their driving skills? So I'm thinking like cataracts or glaucoma, and that's correctable, right? So they might be temporarily unable to drive and then have that corrected. Or maybe they have a cancer or a seizure disorder that's temporary, right? And then they might have to stop for a minute and then can start again. Maybe they're prone to mini strokes. Maybe they don't drive for that reason, or they negotiate that with their doctor. Are you noticing your loved one becoming angry, irritable, or agitated while driving? And this is unusual for them. So this is a big deal because I worked with veterans, right? So older veterans who have post-traumatic stress disorder might be angry, irritable, and agitated, have lots of road rage, right? 20 years before they were encouraged to stop driving. So that would not be a change for them. So that would not necessarily be a warning sign. So if your loved one is pretty regularly at their baseline irritable, and then fast forward 20 years, still irritable, that's not a warning sign. If your loved one was always mild-mannered and pretty like go with the flow and yeah, well, we all share the road and we don't own the road anyway, so what's a big deal? Like, just let them through, and more hospitable on the road, and then all of a sudden are agitated and angry and anxious, that's more of a warning sign. Other warning signs, a friend called me a couple of months ago and was concerned about some cognitive changes in her dad, and then also her driving changes. And some of the driving changes were that he would be on the freeway in one of the left lanes and then cross all the way over to get to an exit without much accounting for the time that it would take to do that safely. And it was concerning. These were sort of behaviors he would never do before. So going back up to close calls or accidents, I have had some of my patients. I had one patient who was in a parking lot and the nose of his car was facing, like storefront. And he thought that he was reversing and he actually was in drive and drove into the store. Okay, so we understood that he actually had gone into the store. Now he knew that he had to reverse to get out, but somehow he had some vascular dementia happening. He didn't do that. He accidentally drove forward further into the store. And so then we were like, we really need to help you stop driving for now, let's see how it goes. And so that's another example. Just, you think you're doing it and your body does something else. Another example, I was thinking of another patient of mine would have lots of like fender benders or hit the curb or nothing major, but like hitting the curb and sideswiping a car when you're trying to park. Those were new issues for him. And so we needed to get him evaluated to see if he was safe to drive. And so I'm hoping that as you look through this list, I'll say also one of the other big ones for dementia is getting lost in familiar places. And so a lot of times what can happen, so a couple of things can happen with dementia. One is our judgment can be impaired. Another, it's not just our memory that gets impaired with dementia, it's also judgment and language. Even our vision can change with dementia, which people don't really know. Even our language can change. Not necessarily the language we speak, but how we're able to recall words, putting together sentences, that can all change. And so what's common in some early to moderate stage of dementia is getting lost in familiar places. And so sometimes people don't get lost until they get lost with dementia. And so sometimes your loved one might be fine going to the store, coming home, he does that every day. And then one day she gets lost, right? And then and then is gone for hours. And then people are trying to reach her. Where were you? Kind of like on This Is Us, if you saw that This Is Us episode, the mom that ending up at the Chinese restaurant. So let's move forward. Let me just say, a quick tip. If you are concerned about dementia in driving, there are a couple of things. One is you definitely need to, and we'll talk about this in a bit, definitely need to be talking with a doctor. But two, with dementia and driving, is there is an emergency response line that is so helpful. It's a combination of Medic Alert, which is that like Medic Alert bracelet that we see, everybody's wearing them. It's that nonprofit. Everybody has, well, when people are wearing them, it's the silver chain link Medic Alert bracelet. So it's Medic Alert and Alzheimer's Association banded together to create a program called the Safe Return Program. You can enroll, if your family member has dementia, you can enroll in that program. It's pretty inexpensive. It's like $60 for the year. And then every additional year, like $30 or something. It's called the Safe Return Program. But what's great about it is you enroll your loved one's medical information with the Alzheimer's Association in that program. And then they give you a protocol for what to do if your loved one goes missing or goes wandering or goes driving and gets lost. And so then you call that emergency line and they work with the police department, Medic Alert, and Alzheimer's Association all together to help your loved one. So that's a great option if you are living with a family member with dementia and they're still driving. Because like I said, I also say this to families, this program works for wandering as well. Your loved one doesn't wander until they wander. And 6 out of 10 people with dementia will wander. Same with getting lost with driving. Probably more get lost than wander. So it could be a helpful program if you're interested. And I have no affiliation with them. I just recommend it to everybody because everybody needs a protocol, a safety plan. So how would you feel if you had a plan for what to do when you notice warning signs? Okay, so let's talk about the plan for when you notice warning signs. And I'm going to take a drink of water. Okay, having a plan is key. So when you're noticing the warning signs, your loved one might say, if you bring this up with your loved one might say, "You're not a doctor. You can't tell me." Or, "You didn't get issue my driver's license. You can't tell me if I'm fit to drive or not," which is true. And so the first thing to do is to schedule, encourage your loved one, and if they're not able, then offer to help to schedule an appointment with their doctor. And here's why this is very important. One is that it might be correctable, whatever's going on might be correctable. If it's glaucoma, if it's cataracts, if it's delirium, maybe they have an infection and maybe they have a urinary tract infection, which is more common with aging, and they're delirious and they just need antibiotics and then they're fine. Maybe they just need to stop driving for a week while they're on antibiotics. Maybe they just had surgery. Maybe all sorts, I had two babies, 2 C-sections. I wasn't allowed to drive for 2 weeks, right? So that could be a temporary reason that your loved one might be having some driving trouble. But you aren't the person who can decide that. The doctor has to decide that. I'll also say, some doctors are more or less comfortable with older adults and doing the assessments needed to figure out what's going on with older adults. But hopefully, if your loved one has a known relationship with the provider will know what sort of assessments to give your loved one. So the first step when you're noticing these changes, it's really important to see the doctor. This might be correctable. And because we don't want people to stop driving before it's absolutely necessary. And by absolutely necessary, I mean, of course, we don't want people unsafe on the road. We want people driving safely for as long as possible for all of those mental and physical and cognitive reasons, and for your health too, right? So we want older adults to drive safely for as long as possible. We don't want to take the keys too soon. And then when we do take the keys, we want a plan. And we don't want to take them. We want our loved ones to say, it's time. And the doctor can really help with that. Another is to ask your loved one to assess themselves. And there are some great self-assessment tools online. And so one of them, the one with the lady, is AAA's 65 plus check your performance quiz. And so I'll send these slides to you if you're interested. You can just link here and get access to the quiz. It's free. You don't even have to give your email or anything for that. You just download it straight away and take a driving self-assessment. Excuse me, the National Highway Traffic Safety Administration self-assessment is here. There's a link there. It's also free. It's not as comprehensive or as engaging as this AAA's Driver 65 Plus Check Your Performance. So this is a great resource. So then it's not you saying, you need to do this, you need to do that, because when people start telling us what to do, we dig in our heels, right? It's okay, well, this is an assessment that most older adults take. Why don't you take it and see how you're doing? Another is to take a professional driving assessment. And so this is more costly, right? So this is where you actually get into a car with an occupational therapist and they walk you through a driving assessment. You demonstrate how well you're able to drive. And to demonstrate how well, how this works, I'm going to play a video for you about Miss Fanny Davis, who's 82 years old, who actually goes through the process of taking a professional driving assessment. And so Fanny Davis was actually, this was a true story, part of HBO's Memory Loss tapes series. I don't know if anybody, it was published just several years ago, but it's great. So I'm gonna stop this for a minute and then get over to my YouTube. I'm gonna stop sharing so I can share something else with you. New share. Okay. Do you all see the memory loss tapes? Okay, now I think I need to stop share again, 1 second, so I can be sure you hear the audio. Share computer sound. Now I need you to tell me if you can hear the sound. Can you hear the sound? think I have to stop my headset. Okay.
Mom told us about 2 months ago that the doctor had told her to stop driving.
That made me inadequate and completely dependent on somebody.
You can hear that?
Yes.
Mom told us about 2 months ago that the doctor had told her to stop driving.
That made me feel inadequate and completely dependent on somebody else, which is not a good feeling after having been, on my own.
She was not very happy with us.
No,
for a while.
I've been taking care of myself. And I was taking care of myself until my husband died. But now, this would be a whole different thing. Oh.
We're going to have an assessment test to see if Mom is able to drive. Even though Mom was told she's in the early stages of Alzheimer's, one of the realities is your judgment becomes an issue.
Hello. Hi.
I'm going to ask you to identify the traffic sign, and then I'm going to ask you what you would do if you came across it in traffic. What is the name of this traffic sign? What would you do if you came across this sign in traffic?
I think I'd stop and make a left turn. I think.
Okay. What is the name of this sign?
I don't know.
What would you do if you came across that sign in traffic?
I will stop and see what everybody else is doing.
Okay, let me write that.
We'll get in the front seat here.
Oh.
Get in the front seat. There we go. So what we want to do is we want to back out and go to our left when you feel like it's safe.
What is reverse? 3 is.
So we want to use the reverse, which would be what? Which would indicate reverse on that?
That's 1. Maybe 2 is reverse. You're going to have to tell me.
The R stands for reverse.
Yeah, okay.
Yes. So,
R is reverse and N is in neutral.
correct.
Okay.
I understand this is a different car for you, so that's why we're warming up in the parking lot here.
Now, where am I going?
And we'll follow Leland here until I ask you to make a turn. We want to stay in the right lane here. Make this next right turn coming up. Make sure we don't go into any oncoming traffic there. We want to stay behind. Can I ask you why you're stopping here? Can I ask you why you did that?
Wasn't
Let's
there a
not
stop
stop on
sign?
the gas. No, there was no stop sign there.
It was some reader.
So,
That stop sign was for another road.
it wasn't for the road that we were traveling on. It was for a different road. Next traffic signal we come to, we'll be making a right turn. It's Big Bend Road. And we'll be making a right turn at this traffic signal. So however you can safely get us, if we have to go past it, we can.
told me
just-
a right turn,
A right turn, correct.
and I passed it.
That's okay. We can get us turned around and we'll go back and then we'll make a left turn.
This place has so many closed off places. I guess I residents only. I can't go up there. Dead end. So, oh shoot. No, I'm trying to decide, should I go up there and turn around? But I guess I'll do it like this. This is the hardest thing I had to do today.
So how you think you did?
They just tell me I can't drive.
You're gonna be just fine.
I'm gonna be in trouble.
We'll come and take you wherever
That
you
ain't
need to
the
go.
point.
We've told you that 1,000 times. Mrs. Fauntleroy will come and take you to church.
That's taking away my,
We go to church
Independence.
with you on fourth Sundays and we drive.
that don't have nothing to do with me going someplace every day. When I want to do it, rather.
But you said yourself you don't go someplace every day.
I don't. But I know that I can if I want to. I'm gonna sit at the head of the table.
Honestly, it's both Steve, myself, and Pat's, recommendation that you continue to follow your doctor's advice.
You mean I
not
can't drive again?
Not drive,
I can't drive?
right.
Okay. Really, what you all are telling me is that I have lost my independence.
It's sometimes, you know what, I think this is a huge issue for her.
Oh, it is.
And it's not just you, Fanny, and because when you stop driving, it's a fact, you can't go when you want to go. You can't do the things that maybe you want to do without a lot of extra planning.
We love you and we want you to be safe. And if you have to be upset with us while we keep you safe, that's okay.
That's terrible. This is really something. Very disappointing. To think that I can't go where I want to go anymore.
You can see, can you all hear me? Okay, good. You can see how impactful the message, you are not safe to drive, is. One, for just the statistics I gave you earlier, but to really see Miss Fanny's response was really heartbreaking. Really, there's a significant grieving process that happens when we lose a privilege, when we lose access. And so she's saying, you're telling me that I'm no longer independent. You're telling me that I'm moving into a new stage of my life, and I don't like this. And I will also say, studies show and statistics reveal that when older women stop driving, they on average die within 10 years, and men on average die within 7 years. And so it's a big transitional moment and a lot of grief. Sometimes I appreciated that they were clear with her. There was no wiggle room, like, no, maybe if you did this or that. And sometimes occupational therapists will give modifications because people can remain safe with modifications, and that's fine. Other times, like for Miss Fanny, this is the result. You're no longer safe to drive. If I was the one as a psychologist giving this feedback in my therapy room, which I don't give, occupational therapists are the one who do this assessment, and I'll show you how to find those. But what I say is, yes, let's talk about the grief with this, just kind of be there to support them. The daughter is in a difficult role because she has to say, we are here to help you and we love you, and we have to be the stewards of safety now. And that's very difficult. One of the challenges with that, though, is that puts adult children in a bind or a spouse in a bind because you're carrying all these roles. So then it's hard to be there when Miss Fanny needs support with grief, because the daughter's thinking, like, if I get soft, does that mean she'll want me to give in about driving? And so it puts the family member or the adult child or whatever your role is who's watching this, it puts you in this complicated role of being a steward of safety and a supporter and now somebody who offers transportation and a caregiver, and it moves you just as Miss Fanny is moving into a new stage in her life. Her daughter is also moving into a new stage in her life, and the whole family has to take some time to adjust. It's going to be rocky. And I say that to say, just to normalize that caregiving is hard. These transitions in aging are hard. I will also say older adults are incredibly resilient. There's something called the U curve of happiness, which basically is we're the happiest at the beginning and at the end of our life. I'm 45, so I'm right at the U, right? And so my hope is, I'll just get happier, but older adults are also incredibly resilient. She has weathered many storms. She has processed many grievances, right? She said, since my husband died, so she's already been through a grieving process. She will get through this too. And it might not be pretty all the time. Grief is not pretty. And so I'm just saying this to say that, your loved one is going to be going through a grieving process, and you are also going to be going through a transitional process as well. And so the empathy and the self-compassion for yourself, so the empathy for your loved one and self-compassion for yourself is essential for navigating this grieving process and this transition. Okay, so let's move back to the slides. Can you see that? Okay, excellent. So there are many places you can go. Two of the most credible places you can go to find a professional driving assessment for your loved one are the American Occupational Therapy Association, that provides a national database of driving programs and specialists. They are the experts who do the driving evaluation that you saw in the video. I'm a psychologist, and we do assessments in other ways. We do not do driving evaluations like occupational therapists do. So this is the best practice if you're looking for professional assessment for driving. It's expensive, and it depends on the state that you're in and all of that, but it's pricey. And I am not sure that it's covered by insurance, but I would always ask. There's also AAA offers a guide to professional assessments as well, which is really good. They might even link to this portal where you can find, but this kind of just walks you through more. It's AAA's guide to professional assessments, and they'll walk you through more what a professional assessment looks like. But that video, I think, is really helpful for illustrating what it actually looks like and feels like. So I'm curious if you can relate to the daughter in the video. So you want to help your loved one stay independent and engaged after stopping driving. Miss Fauntleroy will pick you up. We'll take you every place you want to go. And you don't want to give up your own life in the process. Can you relate to that? That's a tough situation to be in. So if you would like to learn more expert insights for driving safely for as long as possible, or creating a driving retirement plan, so there's this movement around driving retirement plans, which are around really planning before you even have to have these conversations. But driving retirement plans that help your loved one stay independent, because independence is key. And I'm not talking like stay independent, figuring out their schedule and calling you. I'm talking like getting transportation set up so that you're not the one doing it all, and avoid power struggles and arguments. So you kind of have two options. You can stay confused or frustrated or overwhelmed, or you could follow a proven roadmap. And speaking of roadmap, I am just putting finishing touches on my driving retirement roadmap course, which is the only online training of its kind that shows you exactly how to help your loved one prepare to stop driving, stay independent, and to help you not get into arguments and power struggles along the way, so that you really have peace of mind knowing that you're helping your loved one live their best life without giving up your own life in the process. So at the end of the course, if you're interested, you'll have confidence in knowing you've done everything to help your loved one drive safely for as long as possible. You'll have developed a comprehensive driving retirement plan that shows you how to plan for stopping driving. You'll have identified alternative transportation options, honed your skills for having these tough conversations. I walk you through exactly how to have them. And then clarity on strategies for what to do if your loved one refuses to stop driving, which is very difficult. So in the training program that I offer, there are 4 modules. There's staying safe on the road, preparing to stop driving, maintaining independence after, and then what to do if your loved one is refusing to stop. So I put together all of my years of training and resources, and it has a value of $497. And of course, you know that I have a long history of helping families through this, and there would be a money back guarantee if you're not satisfied. But I am, and what you would include is, what the program includes is 8 step-by-step videos, a driving retirement workbook, and live links to expertly curated resources, a few of which we talked about today. But the program will be available for less than $100, so it's $97, because I know that caregivers are stretched thin, especially if you're caring for somebody with dementia. So dementia caregivers pay the most money out of everybody for longest. And so I try to make my programs affordable. And I'm putting the finishing touches on the workbook. And so it will be ready in the next week or so. If you're interested in this course, you can grab this checklist. This checklist is free. We went through it in the slides. And you can just simply head over to my website. It's www.dr for Dr. Regina, KOEPP.com/warning signs. You plug in your email, and then you get this warning sign checklist right in your mailbox. If you are interested in the slides, you can just reply to that email, and I'll send you the slides of this training as well. And so that's it. You just grab your bonus, and then I'll let you know when the course is available in the next week or so. But I want to spend some time, if you have questions, answering questions you all might have about this really complicated situation. Let's see. So I'm going to stop share, and I can put this in the chat box so you'll know where to grab this if you're interested. Okay, there we go. So I'm curious if you all have any questions that I can answer for you around this really tough topic around transitioning from driving to stopping driving, navigating all the family dynamics, worst fears, nightmare situations. That's kind of my jam, are the nightmare situations. Okay, so other alternatives to help families get their loved ones where they need to go. One of the greatest, so here are a couple of options. One is you could call your local area agency on aging. So I don't know where all of you are, but that doesn't matter because almost every region has an area agency on aging. What you do is you go to eldercarelocator.gov and you plug in your zip code, and then you get the area agency near you. Most people in Atlanta get the Atlanta Regional Commission. McKinley might also have resources. But so what the AAA does, that's the agencies on aging, what they do, you can ask for a mobility counselor there, and they will walk you through the different resources available to your loved one near where your loved one is. I think perhaps Ms. Cooper or Ms. Gates could also talk to you about what McKinley does. That one is like a governmental state-funded resource for families and folks. So you could ask for a mobility counselor at your local area agency on aging. Another option is that if you're in Atlanta area, MARTA Mobility also does door-to-door transportation for older adults and folks with disabilities. And so you have to apply for that program. There are also programs with MARTA that will help your loved one, like teach your loved one how to use public transportation. And so they actually go with your loved one on the public transportation journey. But perhaps, McKinley, because you have a transportation center now, might have some options as well.
We do door-to-door as well for Gwinnett County caregivers and seniors. And so, you would just give us a call, we'd make the reservation. If you did need extra assistance, we can also get that scheduled for you as well. So, some people need a little extra help at the grocery store. Some people need a little extra help getting to the doctor's appointment. So we definitely can assist with that as well. So you would just call the center at 678-691-1610. And anyone in the center will be able to guide you to getting a reservation for services. But yeah, we're here and we're willing to work with, anyone that's out of Gwinnett County, even if you have an appointment in, like in DeKalb County or Fulton County, depending what the type of service it is, we'll be able to accommodate you.
And Ms. Gates, what sort of COVID precautions are you all using?
So right now what we're doing is we're trying to limit the amount of people who are riding in our vans. We're asking that when people make reservations, they let us know if they will have a companion with them. We're asking, to limit it to 2 people. We're not trying to schedule where you'll be pooling with anyone. It'll be you. And if you do have a companion or a rider with you, it would just be you and that companion and the driver. And we're asking our riders, to, of course, sit in the back so we can do as much social distancing as we can and to wear masks. And then in between rides, we're cleaning the vans to make sure that they're sanitized and clean before the next rider gets in the van for the next pickup and drop off.
Great. I want to, Ashley had a question, somebody who's attending. Ashley said, I have a friend whose grandpa just lost his wife, and his son and grandkids have told him to stop driving right now. So he's upset and doesn't want to eat and yells at them overall the time. What to do with that? So there are a couple of issues happening there. One is he's grieving the loss of his spouse. 2 is I would encourage the son to encourage the grandfather to see the doctor, because the son might be noticing signs. I don't know when those signs started. If they started after the spouse died, those signs, depression actually can impair judgment. Depression is highly treatable in older adults. So there is a common misconception that older adults at some point become depressed, and they do not. Really, in just the community, 5% of older adults will develop depression. If you're an older adult with medical problems and require home health assistance, your 13% of older, or 11% of older adults will develop depression. If you're in the hospital, 13% of older adults will develop depression. It's not a normal part of aging. 80% of people who get treated for depression get better. Older adults who get treated get better. So that's one, is I would get him to the doctor and have the doctor help the family decide that. Because what's happened, I'm suspecting, for this older adult is that he lost his wife, and now they're saying you have to lose driving too. And so that's like 2 huge losses. And maybe even housing is going to change, because maybe he's not able to live alone anymore. And that might be another huge transition. And so I might have the family start with the doctor, or the older adult start with the doctor, and also share with the older adult. The family might take more of a humble approach, like, we're concerned, we don't know exactly what's going on, we do see something is going on. Maybe your doctor can help us think it through. Maybe that, also antidepressants could be effective for him if he's open to that. Therapy could be helpful if he's open to that, like I mentioned about depression. It might just be typical grief. Who knows? When people are grieving, they don't sleep well. Maybe his driving is a result of not sleeping well because he's grieving, and that's temporary. I mean, there are so many factors. It's a great question, Ashley,
because it's riddled with family concern. We're seeing some changes in grandfather's true experience of grief for loss of his spouse and now potentially loss of his driving. And if the grandfather knows, you know, my wife just died, I'm next, you can't take away my driving too. You know, during COVID, where I'm already isolated, like, of course he's kicking and screaming or not wanting, you know, to eat. Eating is the only power he has right now if his family's taking away other things. And maybe they're justified, right? But I think they need some help to help manage his reaction. And so a lot of times older adults will refuse to take medicine and refuse to eat because there's a sense of powerlessness in other domains of life. Like, now I can't drive, or now you're telling me I need to move into a personal care home. And, you know, what else do I have control over? I have control over what I put into my body. And so we see that phenomenon when we treat the depression, when we help the family out with communication skills, that can improve. People start eating again, people start taking medications potentially, or if they've stopped taking their medications, because they'll say, what's the point? And when people have depression, it makes everything worse. So grief also is hard, right? Like, you know, there's, and so now it's compounded grief because it's potentially two losses. So that's what I would say. Get started with the doctor. Any other, we probably have time for one more question. One of the things I would say, one of the biggest tips I would say if you're starting the conversation is to start from a place of humility. Maybe there is somebody on the call who's an occupational therapist who does driving evaluations for a living. Most of us are not. Even I work with families, older adults all the time. I am not an expert on driving assessment, right? So I would start from a place of humility. Like, I notice, have you noticed any changes in your driving? I've noticed some, can I share them with you? What do you think about that? Have you seen your doctor? Can I help you see your doctor? Who do you know among your peers who stopped driving? What was their experience like? You know, just to start, and I'll say, these are conversations. It's never a one and done deal with these big transitions. And so if you're gonna start the conversation, I would start from a place of humility, test out the water, back off. Unless there's a crisis happening, then you might need to get authorities involved. If you're really concerned, get the doctor involved. If it's a crisis, you might have to call 911. But the issue with 911 and many of our African-American families is the risk there too. I did have a family, an African-American family where this is not a driving issue, but the older male in the couple was like in his mid 80s, thin, pretty frail, but agitated with dementia, kind of mid to later stages of dementia. The wife called for help because he was getting violent and explained that he had dementia. The police came, arrested him, took him to jail. And I hadn't met them before the first meeting. The first meeting with me was, we have to go to court. Can you assess him and say that he has dementia so we can present this to the judge? And he had, it was evident that he was very impaired from a dementia disorder. And so I'll say that I understand, you know, with all the police issues happening in the world for African-American folks and families, just to be mindful and cautious. This is potentially also where the Safe Return program could be helpful. If you enroll your loved one in the Safe Return program, Alzheimer's Association works with the police department. So in addition to you as a family working with them. So to help also with some mediation and education about Alzheimer's or other dementia disorders. So that's important as well. I know we're at 1 o'clock, but I hope that a lot of the information I shared was helpful. I hope that you do, as family members, start the conversation with humility and grace, and then have more, and then have more, and then have more. It's going to take a while. I mean, because imagine, what if I told you, hey, Tomiko, I'm going to have a conversation with you about a big change in your life that is going to double your risk for depression. It's going to increase your sense of isolation. It's going to keep you away from friends and family. It's going to keep you away from your doctor. It's actually going to keep you away from even going to the grocery store. Would you like to have that conversation with me? No.
I've already seen my head moving like
Right.
no.
Nobody wants to have this conversation. And so the more you could do it with love and grace and humility and respect and earlier, the better.
The better. Dr. Cap, thank you so much. This is exactly the conversation, the starting point, at least knowing where to begin the conversation, because like you said, this is an ongoing conversation, unless it's a dire emergency. And that's what McKinley Caregiver Resource Center is about, is being, helping caregivers be proactive, getting the knowledge, getting the resources early so that we're not always operating in crisis mode. So I thank you so much for your time, all this wonderful information. I will be in touch with you. I thank you so much.
Yeah, thank you for having me. And really for the people who are here, and to you, Tomiko, because I know this is a personal story for you, this is a long road.
Mm-hmm.
It's so essential. I mean, I cannot express enough the importance of empathy for your loved one and compassion for yourself as you go through this long road. Those are the two, I think, tenets that will carry you through this. There are going to be lots of ups and downs and heartbreaks and headaches. And the more you can stay grounded in your own empathy and your own self-care and self-compassion, the better you'll be able to get through it.
Thank you so much, Dr. Cap.
Thank you, Dr. Cap.
Yes, so thanks for having me, and be in touch if you all are interested.
Absolutely. Absolutely.